I don't even know what I'm looking for. So my kids hit their heads all the time. And my wife, who got her medical degree from Google University, always tells me to do this and that to check to see if they have a concussion. But neither of us have any idea what we're doing. So today I'm talking to a real physician with a real medical degree about head injuries and how they can go wrong. So today we're joined with Dr. Creig Shute on a Zoom call. Dr. Shute, thanks for joining us today. Can you tell me a little bit about your background?
Yeah, thank you guys for having me. So I started out as a military physician. I was on active duty in the Army for 5 years as a doctor. I came back to Lafayette in 2014. I worked in emergency medicine for a couple of years, and then with Lafayette General for a couple of years, and then just recently sort of struck out on my own again with a company called Elite DPC, which is a direct primary care.
Today we're talking about fall sports and particularly concussions. Do you have any experience dealing with concussions?
Yeah, so I worked in multiple traumatic brain injury clinics while on active duty in the Army, and then I actually was involved with concussion care with Lafayette General for a couple of years and was the medical director for a company called Concussion Solutions while I was with them.
Your experience, what activities have you seen produce the most concussions?
Yeah, so the obvious answer to that is football produces the most concussions. And then in my practice, number 2 was actually cheerleading. And most people think about, the flyers, the girls that are thrown up in the air, but actually it's the bases, the girls that are on the ground doing the throwing, have girls land on top of them, and those are the ones that actually get concussion.
Is there any particular parts of the head that's more susceptible to a concussion?
I mean, the answer is yes. There are certain parts of the head that maybe flex more than others, or the skull could be thinner in certain places, but generally speaking, you can get concussions from impact on any part of the head.
Okay, I poked fun earlier on the video about my wife having her medical degree from Google University. When our kids, I have a 2-year-old, and he'll bang his head on the ground because he's mad. And so it's concerning to us. And so we're down on the floor, she's got the light poking in his eye. Hey, don't fall asleep and all this such. We don't know what we're doing. Can you tell the audience what to do?
Yeah, that's a great question. So in a child, especially a small child that you're having trouble communicating with, it's important to just understand what their baseline is. If you see changes to their personality, obviously, if he was to do it and lose consciousness, he probably should be seen by a medical professional. It's really just about change in personality or change in behavior. If he's throwing a temper tantrum and hitting his head against the table, if he continues to throw the temper tantrum, he's probably okay. He'll probably stop when it hurts enough. But the concern for concussion would be, let's say several minutes after that, all of a sudden he becomes lethargic, or he starts throwing up a bunch, starts having just general changes in his personality. And it's hard. I mean, it's different for every child.
Well, my wife tells me to keep the kid awake. Is there any truth to that?
No, that's actually a wives' tale. So if a diagnosis of concussion actually is given, the treatment for that is rest. The rest that we're talking about is getting someone on a good sleep schedule and actually allowing them to sleep, because getting into sub-REM sleep is actually where we recover from concussions the best.
And another thing I was just thinking about, let's say, for instance, you have a teenager at a football game on Friday night, and from what you can tell, nothing happened in the game, nothing out of the ordinary. Is there a good practice to do to make sure your kid's doing okay? There's no concussion symptoms? Is there anything you can communicate with your child about that?
Great question. So, if nothing particular seemed to have happened in the game and no one has expressed any concern, then just observation is fine. I mean, if you're a parent of a teenager, I don't think any human or any adult in history has figured out how to properly communicate with teenagers. It doesn't really happen that well. But if you start noticing personality changes, if they seem to have loss of memory, especially memory of the game, if they tend to ask the same question over and over and over again, if they're complaining of visual disturbances or light hurting their eyes or ringing in their ears, obviously any nausea, vomiting, or if anything you see seems a little off and that seems to be progressing, all of those are concerning. And look, at the end of the day, if you're concerned about whether or not someone has a concussion, then you really just should have them seen by a medical professional. If someone else has expressed concern for something they maybe witnessed but you didn't, then they should just be seen by a medical professional.
So in essence, just don't do what we're doing, trying to be the doctor, pointing the flashlight in the kid's eye, right?
Yeah, leave that up to the medical professionals. If you need to, call the pediatrician, go to an urgent care, go to an emergency department. If you're a member of Elite DPC, then you can call me directly anytime.
Your facility treats patients with those symptoms?
Yeah, so any licensed physician should be able to see and assess someone with a concussion. We certainly can see kids. We limit our practice to our members, but any medical professional really should be able to see concussions. But I can tell you the best place in Acadiana, if you really want to send somebody to the best, then you can contact Tommy Dean at Concussion Solutions, or just call UHC and contact the sports medicine fellowship there. Those are the guys in town that are actually running the concussion program for Lafayette General. Or you can just call Lafayette General directly and they can put you in contact with the right folks.
What's your experience for the long-term effects of an undiagnosed concussion?
Well, that sort of depends on whether or not someone has gone back to high-risk activity and had secondary injuries or third and fourth injuries on top of without fully recovering. I mean, at the end of the day, with a concussion, over time, patients should get better with rest. A single concussion, by definition, is temporary and shouldn't cause any permanent problems. The problem really exists when you have multiple injuries on top of each other without recovering between injuries. If someone identifies a concussion, actually by Louisiana law, they cannot return to that activity until they've been released by a licensed professional.
Oh, that's good to know.
So look, at the end of the day, if you're concerned about an injury, if someone else has reported concern, saying that they think they might have a concussion, they just should be seen by a medical professional.
Thanks again, Dr. Shute, for joining us. If someone wants to get in touch with you, how would they go about doing that?
Oh yeah, thanks. They can go to our website, elitedpc.com, or they can call us directly at 337-243-0143.
Okay, thanks again. And lastly, I'll tell my wife to stop practicing medicine without a license.
Yeah, that's a great idea.
Take care.
Yeah, thank you very much.
I want to thank Dr. Shute for joining us today. To recap, if your child is involved in sports or is accident prone like my child is, just be mindful of these symptoms. But like Dr. Shute said, if you're concerned about your child, go seek immediate attention from a healthcare professional. I'm Blaise Zena with Murphy's Law and Dunn. Just remember, just because it can go wrong doesn't mean it has to.